Đúng chưa? Thấy không? Thấy không? Nào chưa? Nó đi nhà chứ đâu. Vì muốn đi chơi mà thì ăn đi không là cái gì nó đi đây học bài nó đi đâu đâu không mà nội nó lại không nội đâu có đi chơi em bắt đi người nói gì cái mình chỉnh gì chưa không sao thấy áo khác nó nè áo khác nha má đi học bài chơi với con được rồi cuối tuần này mẹ dặn con đi chơi mẹ hứa cuối tuần này má bị thi xong rồi mẹ dặn con đi chơi nha. Bài để cho nó nhận bài chứ đúng không?
Hello, everyone. Good evening. You guys hear me?
Hello.
Yes.
Hi.
Hello, hello, hello. Everyone, please turn your cameras on so they can see you. I have a couple of students who had the permission to keep it off, but others, please turn it on. Excuse me. Come on, everyone. There are many cameras still off, so please turn it on so that I'm not scared, okay? I'm a scary cat. Don't be a ghost.
Hello, Professor.
Hi there, how are you?
I'm good. How are you?
Oh, I'm still here.
Thank you.
All right. Okay, got a couple of messages. I think somebody's driving home, and okay. All right, let's start it. Give it 5 minutes, people to settle down. And if you're doing something, wrap it up, guys, and please turn your camera on. Okay. All right. Any question, concern before we move on? I did read a couple of messages from you guys about you're not able to find that review thing from ATI. So let's see if it gets resolved today. I'm also having some issues with the ATI. I can't even see much there. And if you're not able to by tomorrow afternoon, if you're not able to get that resolved, submit everything else. Okay. So leave what you're not able to find that review by tomorrow afternoon. If you're not able to, make sure that everything else is submitted correctly. Okay.
Professor, regarding the ATI remediation, in the focus review that was given for me, I don't see a quiz on there. Is that located somewhere else?
The quiz, guys, who did that? Was your quiz was the quiz showing up there, or you had to navigate somewhere else? Excuse me. Can someone share that, please?
So are you talking about the quiz after for the remediation or the first quiz? Because for the remediation, if you below 75, then it will be a quiz. But if it above 75, then there's a no quiz.
Okay.
Okay.
So
All
on my
right.
individual report, Professor, there was a analyze queue that gave me like 2 questions, and I only got one of them right. But for that category, that section, I scored above a 75. So that's why I was like, is remediation part of it, or it's so confusing.
That excuse me. That was the reason that I sent message and then also posted announcement because that's how they put it up in the added in the course. And they made it two parts, and they did not give any points to the test itself, but the remediation they gave 100 points. So I wanted to give everybody opportunity to improve, learn, improve, as well as grab those points. Okay, and that was the reason I put it up, that regardless of your grades, do it. I hope you guys read the announcement.
So,
Yeah.
Professor, if we have like 97, 95%, are we still doing the remediation?
Okay, look, it's not, if you're not doing it, the only thing I cannot give you any points.
Oh, so even if we get 95, we're not getting any points for that? Oh man.
as I explained it in the message on Canvas announcement, that this is a two-part assignment, and the test itself does not carry any points. And that is the reason I'm encouraging everybody to do the remediation regardless of the points you got, so that you can have some points as well.
So, Professor, you say it handwritten to remediation. That where we just use a paper and then learn the portion that below 75% and write it out and print it and send it to you. I mean, sorry, submit it online. Yeah. Okay. Thank you.
Okay. You're welcome. Any other question, guys, before we move on? No? All right.
Actually, I'm sorry. I do have another question. So,
Yeah, go ahead.
for example, if we score like above 75% and we still have to do that, do we have to do the 10 car or any category that only below 75 that we have to focus on and do that and submit that?
Then pick up any other topic.
Oh,
whichever
okay.
you want to improve on.
Okay. So for example, I have 4, so I only have to do 4 car, or I have to do 10 of them.
So do so there are 4 you said which are below.
Yeah.
That, and I believe the instruction says up to 10, right? It doesn't say that you need 10, correct?
Oh, okay.
All right.
Thank you.
You're welcome. Anything else, guys? Are we ready to rock and roll?
Ready to rock and roll.
Ready to rock and roll. Well, where are you hiding? I can't see you.
Sorry. Here I am.
Come on, don't disappear, guys.
Sorry about that.
I'm scared of ghosts. I told you, like, I don't know who's sitting back there. I'm gonna run away from my computer.
Sorry, Professor.
Okay, no problem. Okay. And everybody is aware about how many questions in the final exam?
75?
Yes, everybody clear about that? Yeah? Okay. And also, there are questions from all modules, okay, but focus more on module 6 and 7. They has a high number of questions, those modules in the final exam. Okay. Any question regarding that? Everybody is clear, understood that point? Yeah. As I said, just once again, there will be questions from all modules. Okay. From 1 through 5 as well, but there are less questions, high number from module 6 and 7. Okay. I think one of them has like 30 something, the other one has 20 something. The 1 through 5 has 20 some question, 23 or something. Rest are from 6 and 7. Okay.
How many math does it have?
I don't think there's much. There might be some conversions there. Okay. Alrighty. So let's move on, guys. So 1 sec.
Professor, can I have a question?
Shayla is gone now. Come on.
Yeah.
That's okay. Yeah, go ahead.
Do you think it's possible for the exam, the last supposed to be 2 hours? And for example, in my situation, I take a little time to read because this is my second language. Do you think you can extend a little more, maybe 15 minutes more?
Sorry, Consuela, I'm sorry to interrupt you, but your voice is like, I don't know, you're trying to scare me or something. It can't understand quite well. Can you repeat your question?
Do you think it's possible to be a little more than 2 hours? Because I just barely finished the 75 question, And just in my case example, if this is my second language and it's taking me a little time to understand, I know I got it, but it's still 2 hours. It made me more nervous when the time is go fast. You know, this is my worry because the 50
Oh,
question
mhm.
I finished, but 75 question I have to think very well before do my answer, and I don't want to fail.
Okay, I understand. You know, your concern. They are genuine. I'm not saying that it's not genuine, but unfortunately, we cannot change the time. The time is set for everybody, for all campuses, all cohorts, just the standard time value, and it doesn't change unless somebody has uh, previous previously approved accommodations and has a paperwork going to the doctor with certain conditions. But other than that, unfortunately, there's no way for me to extend that.
Oh, okay.
I wish I could. I mean, if it was in my hand, I would have done it. Okay, but it's not.
Okay,
Okay,
thank you anyway. Thank you
yeah,
so much. Thank you.
no worries. You guys will pass. Okay, focus on what I'm telling you. Focus on important things. Leave the clutter out. Just for 2 more days, guys, and you're done. Right? 2 more days, and right, you know, you're gonna get a. Did you guys get an email or something about course feedback or something like that? Yeah.
Yes, every
Yes.
time we open, we see that. But I'm
Yeah,
waiting. I'm
it's
waiting and
bugging,
for
right?
you.
It's annoying, right? Every time you open up, it's right there,
Yeah.
right? Unwanted ads. Yeah, they're not gonna leave you alone. So if you could please do that. Maybe I don't know if you. I don't think it's lengthy. It's quite short, and if end of the session, if you guys can share your feedback, that'd be great.
Yes.
You got it.
Okay, thank you.
Professor, are
All
you
right.
teaching us anything else after like, or this is
Uh,
it?
the only other thing I usually get involved in is the capstone, the last leg.
So we'll see you in the
Look,
end.
look, I bug you guys. I give you headache when you start, and I get up again and say, "Here I am, still here. You all done, buddy? Here again, right?" And then, so capstone. Not always. If I'm available, then I do cover that. Some clinical rotations. I don't go there, but I make some visits, and then I do weekly meetings and support students in the during that journey. So
I hope you are
maybe I'll
able
see you again.
to do that. It's very nice to have a teacher like you, Professor. It's a
Oh,
very
thank you for the
when you're
kind
Thank
feeling
you.
words.
down, it's like, okay, we can do this.
You
Wow.
can. I'm not doing anything. It's you guys who are doing the hard work, right?
That's
I didn't
true.
study for you. You guys did. All I'm doing is just showing you the right path. I'm supporting you. You are fully capable of doing this. That's why you all are sitting here. Okay. And I'm telling you, you guys are going to pass. Okay. And you guys are going to do well in the program as well. Just trust yourself. It's normal to have that anxiety, that feeling, oh my goodness, I don't know what's going to happen. Oh, am I even up to the mark to do this? Yes, you are. Trust yourself. Don't underestimate yourself. Both things are bad. Extremes are bad. Overconfidence and also underestimation. Just be what you are. You're good enough to handle this. Okay?
Thank you, Professor.
Righty. And one thing, remember this. You are handling what? A fragile package, right? You know, when you drop something, you receive a package from UPS or something, and it has a sticker outside. Fragile, handle with care. Things can break anytime, right? So this course is very fragile. You gotta stay focused, do the right thing in the right manner. Okay. doing over and not utilizing the time, your energy, your focus on the right material can put you at an uncomfortable spot. And that is the reason I always say the first thing is ask yourself from where and what I need to know about it. Don't try to know everything because you don't need to. So just know what you need. Okay. Alrighty. Let's move on, guys. Okay, so today's session might be a little longer, so be ready for that. Okay, have coffee, tea, whatever you like. I have, look here, I have fresh coconut here. That'll help me. Okay, guys, ready for the first question? Yes, yes, yes. Okay, here you go. Can you see my screen? Sorry, I didn't even ask. Can you see the full screen? Yeah, okay. Thank you. Think like you're sitting in the final exam, okay? And try to answer even quicker than that. Your mind will be conditioned. Read it once and go with the best answer. We'll try to keep up the pace. We have quite a bit of questions. Alrighty, so, and I will say it again, guys, please try to answer. Okay, don't just read it. Make sure you're answering it. Okay, as I always say, there's a process. Don't worry about the result. Work on the process. You will have the results you want it. Okay, all right, so I see here majority answered A, that's 100% correct. First thing, non-pharmacologic is always the first thing, which is lifestyle modification, diet, exercise, that, right? If that doesn't work, the first thing comes in metformin. Okay, metformin. Okay. Next. And this is an important thing related to metformin, so I just wanted you to know that as well. Okay. Great, yes. 100% correct. B is the right answer. And let me add a little information in there. It says hold metformin for 48 hours after the procedure. Do you know how long before the procedure it should be held? Or does it even need to?
It
One
does.
day.
1 day. So 1 day before, 2 days after. Okay, total 3 days. If you are not able to screen this, you may damage your patient's kidneys forever.
Is it the
May-
lactobacillosis, Professor?
Lactic acid, yes. Okay, perfecto. Next. This is a drug from different class. Metformin is a bigonide, which is the only drug in that class, and you don't have to worry much about the hypoglycemia part. But there are some drugs which carries high risk. All diabetic drugs do not put your patient at risk of hypoglycemia, but some are, and they're high risk. Okay, perfect. Good job. Good job. Good job. As I always say, guys, keep things simple, right? Keep things simple. Why we are giving this medication? Because patient's blood glucose is high, right? That's the problem. Now you brought the drug to bring it down. What's the most common thing can happen? Maybe going down, right? Opposite of what we're trying to fix. Maybe you fixed it a little too much. You were a little too kind, right? And you fixed it, but a little tight, right? So hypoglycemia, that's what you should be monitoring a patient for. The reason, what's the difference between metformin and glyburide? Metformin does not push pancreas to release insulin, which eventually decrease blood glucose. So that's why it doesn't cause that risk. But glyburide, glimepiride, glipizide, right, or your insulin injections you're giving, they start poking pancreas like, hey, we need more insulin. And when pancreas produce that, and overproduction can cause hypoglycemia. So that's why only drugs which increase the release of insulin, that's what you should be worried about the hypoglycemia part, not others. Okay, next. So this is once again common sense, right? Patient has what problem that we are giving them? Insulin. Insulin reduce the blood glucose, right? So common sense, patient has high blood glucose, right? So we give them insulin to decrease it, right? Decrease it. So the common sense says, don't give it if it's somebody already has low blood glucose, right? That's all needed to answer this question. Patient has blood glucose 55. Why would you give it? It's going to drop more, right? We don't want to make a patient unconscious. So that's all you need to know. So anything below 70, it's called hypoglycemia. Anything below 50 is high risk. Very high risk. Okay, now let's look into a couple of situations here. So this is the first one. Patient type 1 diabetes, unconscious because of hypoglycemia. It could be type 2 or anything. Just know about hypoglycemia. And what's the keyword? Unconscious. So what you should do first. Perfect. Good job. Yes. So patient is unconscious, nothing orally, right? Nothing PO. And unconscious patient, intramuscular on the side of thighs side, right? And you can give it through the clothes. You don't need to remove the clothing, okay? Through the clothing is fine, and inject that glucagon. All right. There's another thing. Do you guys know what else do you do before you administer glucagon?
Put the patient on the side.
Yeah, put the patient on the side because it can cause
Vomiting.
vomiting. Okay, perfect. Good job, guys. Proud of you guys. All right. Now, you as super nurse is caring for a patient given prednisone for long-term management conditions. Say maybe they have rheumatoid arthritis or something. What should you monitor? Yeah. Sorry, guys. Little technical mistake thing. Sorry, I have to share it again, I guess. Okay, there you go. You're still able to see my screen, guys? Yes. Okay. All right. So yes, blood glucose. Always remember, steroids, long-term use, they are going to increase
The blood sugar.
blood sugar. Okay. And if you have a patient, that situation, what to do? Those patient has diabetes, they're on medication or insulin, whatever. What should you do? All right. Yes. So when is a known reason that the patient needs the steroids for, say they have a severe infection, they're in hospital, right, and the blood glucose going high. So you want to manage their diabetes, but at the same time, it's crucial to treat the condition they're experiencing and they need steroids. Well, then how to manage it? Give them something additional, the drug, either PO or it's an injection, insulin, increase the dose for that duration and then taper it down once they're done with it. Okay. All right. Now let's talk about diabetes insipidus. Given desmopressin is a priority monitoring. In order to answer, we need to know like what it is and what it does. What is desmopressin, guys? It's nothing.
Decreases urine output.
Is it
So
diuretic?
it's an anti-diuretic hormone, not diuretic, anti-diuretic. Means it will reduce the urine output. Okay, now the correct answer is B. The reason, whenever you're going to have imbalance of volume, right, fluid, well, the electrolytes are going to be imbalanced. So if you have more volume, right, so volume is more. Now the electrolyte quantity is still the same, right? So you have less in more. That means hypo, correct? So if you're giving them diuretics, then maybe the volume is less, the content or concentration higher, then might be hyper. So in this case, it's hyponatremia and fluid retention. Remember, it's a anti-diuretic, blocks the outflow. So when outflow is reduced, more is retained. That's what we need to monitor. Yes, guys with me on that? Okay.
Sorry, Professor. So you mean like volume increase, electrolyte will be decreased?
Okay, so let me give you an example.
Yeah.
Okay. Suppose you have half cup of water, okay, and you added 1 teaspoon of sugar in that, right? So if you taste it, how it's gonna be as compared to now you added another half cup of water in that, your sugar content is same. So what did you do?
You diluted it.
You diluted it, right? Means your concentration went down, lower, right? That's what happens here. So volume increased, but Your electrolytes, the same content, it's same. So now it's more diluted. So it's called hypo. Okay. Anything else? Is it clear now? Anybody who still didn't get it, please ask. Everybody's good? Look, I want to make it clear to you guys that this session is important for you guys. All right, it's important. So if you have a question, please ask. If you didn't get it first time, ask again. If you still didn't get it, ask again. I will sit here. I will spend extra time with you, but I want you to understand. Okay, I know the value, the importance of this exam for you guys. I don't mind spending extra time. Yeah.
So in this situation, the answer should be number B, right?
That is correct.
Okay, thank you.
Okay, so how about this question? Patient given Montelukast, which is a single layer, brand name single layer. It's a Lutra, I call them Lutra, LTRA antagonist. So chronic management for asthma, people in allergies, seasonal allergies also take that. Look, you're looking here for statement for further teaching means incorrect. Come on, everyone. Try to answer. Okay, so the correct answer is B, okay? B. We're looking for incorrect one. If you read the first one, I will take this medication once daily in the evening. That is 100% correct, okay? Montelukast always once a day in the evening. The reason? It causes sedation, okay? Drowsiness. So we don't want to cause any safety issues if they take it in the morning, right? Comes in only one strand, 10 milligram once a day, right? And this medication is not used for acute asthma attacks. It doesn't do anything good that quick, okay? It's for prevention. Nothing for acute symptom control. This medication help prevent asthma system? Yes, prevents, but does not replace my rescue inhaler. Rescue inhaler is which acts quick, right? I should continue taking this medication regularly, even if I feel better. That is correct, because it's for prevention. You're feeling better, it doesn't mean you're going to keep feeling better. So B is the correct answer. Next, this is also about Montelukast, patient for asthma management. Need further teaching. Oh, great. Yes, this was an easy breezy one. It's not a rescue medication. Once again, it's to prevent any complication. So yes, once a day in the evening. And important, this drug has known issues. Okay, so this is a contraindication as well as something important to monitor. If patient is taking it, watch patient's behavior, mood changes, depression, suicidal thoughts. That is something reported. Okay, so there's a data supports that this can happen. So make sure you monitor patient for that, or let the family caretakers know to monitor these symptoms. Okay, and always it takes several weeks, pretty much all chronic condition medications that take few weeks to work. So if somebody already has suicidal thoughts, they shouldn't be taking this. Okay. Let's talk about some allergy stuff. Okay, allergy. And here's Benadryl, diphenhydramine, which is an antihistamine. Now, who needs further teaching? Okay, nice. Well done. Yes, D is the correct choice here. Somebody having glaucoma? What is glaucoma? What's happening with them? What's increased?
Intraocular pressure.
Intraocular pressure, and any antihistamine is the worst enemy. So it will increase intraocular pressure. No, right? That's a big no. And avoiding driving, yeah, important because they'll be sleepy. Remember, all antihistamines, anticholinergics, they make your patient slow, sleepy, drowsy, dry, right? Alrighty. Next. So this is also about an older adult patient. So patient is old and prescription for anticholinergic medication. Who needs further teaching? Okay, come on, guys. Come on. Quick answers. Okay. Yeah, so D is the correct choice here. I can use this medication if I experience difficulty urinating. No. Anticholinergic, antihistamine, not a friend. It will increase urinary retention, increase intraocular pressure. So no for glaucoma patients. Right? Your older patients who has BPH, benign prostatic hyperplasia, they have issues with urinating, and if they take it, they're gonna yell at you. All right, next. So this is select all that apply one. Providing education to patient who is taking anticholinergic. Potential risk associated with this medication. Just think about a patient is going to take Benadryl, say diphenhydramine. What can happen? Do you all agree? The patient urinary retention, right? I'll experience that. Dry mouth, remember, slow, sleepy, drowsy, dry, right? And diarrhea. Do you think that is correct? No, because we're talking about dry, right? They can have constipation, but not diarrhea. Blurry vision? Yes. Increased sweating, slow, sleepy, drowsy, dry. No sweating, right? How about tachycardia? Yes.
Yes. Oh,
Yes.
follow
Now,
that.
these are two different things. You might be thinking, oh, slow, sleepy, drowsy, dry means everything low. not the heart. Okay, slow, sleepy, drowsy, we're talking about CNS. That's a different system we're talking about, but it can increase the heart rate. Okay. All right, next question. Patient here taking loratadine, Claritin. Okay, plain Claritin, not Claritin D, for allergies. Which statement indicates need for further teaching? So first one says take the medication daily during allergy season. Well, definitely that's what the rule is in allergic rhinitis. You don't want to experience those symptoms in order to prevent that. That's why it's given. So it started early so that they don't experience that. It may cause drowsing, so I should avoid driving. Well, good. Usually doesn't cause that much, but hey, these can to some extent. I can take this medication with or without food, perfectly fine, but you can never double dose. That's a very simple, straightforward rule for any medication. Never double dose anything. Okay. If somebody took too much of cholinergic, remember there are two types of drugs, cholinergic and anticholinergics. Now, anticholinergic, like antihistamine, like Benadryl, they make slow, sleepy, drowsy, dry. On the other hand, cholinergics, what they gonna do? Perfect. Yes, B. So cholinergic, remember, will make wet. Anticholinergic will make dry. Okay, so all secretions will be increased. So B is the correct answer. Salivation, lacrimation, urination, diarrhea, all gonna go more. Okay, how about that you're caring to patient with excessive salivation, lacrimation because of a pesticide exposure, say it was a cholinergic agent. Okay, which medication should the nurse anticipate administering as an antidote for cholinergic? Perfect. Proud of you guys. Good job. Yes, atropine is the correct here. Atropine. Atropine is given as an antidote for cholinergic toxicity. Okay. How about completely opposite? Overdose of anticholinergic. Now all secretions are dried. What to give? Okay. So majority answered correctly, but they're here left and right there. The correct answer is C. Physostigmine. That's an antidote for anticholinergic toxicity. Remember, naloxone is for opioids. Flumazenil is for benzodiazepine. Yeah, benzos. And atropine we just talked about in the previous question, right? So that was out of the question. So it is C. Okay, how about next question? Your patient has nasal congestion. Talking about OTC decongestant. Can you identify which one is a decongestant? Okay. So here as well, majority answered correctly, but there are few wrong answers, okay? C is the correct one, pseudoephedrine, okay? Sudafed, that's a decongestant. Diphenhydramine, it's an antihistamine, right? Benadryl. Loratadine is also, it's non-sedating, right? Benadryl, diphenhydramine is the first generation, and loratadine is the newer generation one. They're called non-drowsy or daytime ones. Guaifenesin is an expectorant, okay, to thin the mucus, not a decongestant. Pseudoephedrine is. Okay. Patient has congestion because of seasonal allergies, given pseudoephedrine. Who needs further teaching? Pseudoephedrine has, stimulant effect, so it shouldn't be taken at bedtime, but it should not be taken for a long time. Usually 3 to 5 days, but that's it. So B is the correct choice here. It can increase the heart rate and can cause palpitations. And a patient who has hypertension, they shouldn't take it. Okay. Next, once again, select all that apply. Pseudoephedrine for nasal congestion. What are the contraindications? We just talked in the previous question. Hypertension, we talked about it, right? To what? Somebody has hypertension, they shouldn't take it. How about glaucoma? Decongestant should not be taken by glaucoma patients. Increase in intraocular pressure. Hypothyroidism doesn't matter. Coronary artery disease, yes. BPH, yes. Asthma, no.
So the
Okay.
correct answer is
ABDE.
ABDE.
Mm-hmm.
Thank you, Professor.
Okay. All right, next question. The patient has cough. Now there are two types of cough, okay? Productive and non-productive. Productive is the wet cough, which patient has sputum, right? And non-productive is the dry cough. No product, no sputum. So when your patient has productive cough, you need to thin the mucus to make it easy. But if somebody is having cough, but it's not going away, okay, then you, and they have like the lung seems like they have mucus, it's not coming out. Well, then you may need medication to do what?
Currently?
All right, so here your patient needs guaifenesin, which is an expectorant. What they do, they help loosen and thin the mucus in the airways, which makes it easier for them to cough up the secretions and clear the respiratory tract. Okay, now this patient has non-productive cough. What are you expecting to give? Come on, everyone. Try to answer. So B is the correct choice here. Dextromethorphan. Okay, Dimetapp. That's a cough suppressant or antitussive. Dry, non-productive dry cough. You're telling them, shut up, stop bothering. Okay, you don't know the reason, coughing, you're just shutting it off. Okay. There's guaifenesin we just talked about. That's an expectorant to help loosen the mucus. Acetylcysteine, it's a mucolytic, which thins the mucus secretions in your cystic fibrosis patients. And albuterol is the inhaler and bronchodilator. So what left is your dextromethorphan. Okay, next. Patient
Sorry,
has a
Professor, can we go
prescription.
to previous question? I'm so sorry to interrupt.
Sorry,
Can
what
we-
was that again?
Can we go to previous question for a quick second? Thank you. Oh, okay. Actually, I thought I missed a question.
Okay.
Sorry about that.
No problem. Carbamazepine for seizures, anti-seizure medication, carbamazepine. Who needs more patient education? Once again, common sense. Seizures, undesired, right? Needs chronic management to prevent future complication. So it has to be taken regularly. Cannot stop taking that. So C is the correct choice. Okay. Yes, they should avoid grapefruit juice and everything else, or monitor the serum drug levels as well, because carbamazepine is a neurotherapeutic index drug. Okay. So same drug, carbamazepine, for same condition, seizures. Which findings should immediately be reported to the doctor? You may have multiple things which applies, but what's the priority? Excuse me. Okay. Only a few exceptions. Everybody else answered correctly. C, yes. C is the correct choice. Fever, sore throat, and pallor. Do you guys know why it's important?
Is it fever can increase the risk to have seizure or infection?
What is it about? They can increase the risk, or is something else behind that? It's all related. Okay, let me take you backwards. Okay. Fever, sore throat. What does it indicate? Possible. What problem?
Infection?
Infection, right?
Extra
When does that happen?
Is it a reaction?
Okay. And which lab tells you what is high when somebody has infection?
WBC?
WBC, right? WBCs are high. Okay. Now, try to connect the link. Patient is having fever, sore throat, and all that. Okay. And what could be the possible link here?
Meningitis? I'm just saying. No.
Okay. Now,
Maybe bone marrow suppression.
Yeah, brilliant. Yes. Bone marrow suppression. That's where all these cells are made. Okay. So bone marrow suppression, it can cause a granulocytosis. Okay. Then aplastic anemia, leukopenia, all these causes an increased puts your patient risk of serious infections, and that's what the symptoms are telling you. Does it make sense? Yeah? Okay. Next question. Once again, carbamazepine. Patient has multiple new bruises without the known injury. What to do, guys? What's important? This wasn't easy, right? Same concept, right? Who is responsible for these cells?
Bone marrow.
Bone marrow, and this drug causes bone marrow suppression. What if it's causing low platelet count, thrombocytopenia, which can cause
Bleeding.
increased risk of bleeding and bruising? Yes, agreed?
Yes.
Okay. Okay. Here is another drug for sertraline for depression. Which statement indicates the patient doesn't understand it well? Need more attention. So apply the common concept, right? General concept. No drug is safe when taken with alcohol. That's it. Simple, simple, simple. Right? They switch or what?
Yeah, it was the next
Switch.
question.
Okay. So sertraline, right? So correct is C. Drinking alcohol while taking this medication will not affect me. Not true. Not true. It can cause CNS depression. And always, these drugs take few weeks, 4 to 6 weeks usually, to show some sort of effect. And never abruptly stop them, especially these CNS drugs, never abruptly stop them. They'll have the same issue again. Okay. Next. Evaluating therapeutic efficacy of sertraline in patient with depression. Which statement indicates the intended effect? So patient has depression. You're trying to help so that they are not depressed. And what is telling you they're not? Good job. Yes, B. They feel less anxious, less worried, and they're able to enjoy things they are doing. Remember, depression, people suffering from depression, they do not enjoy the activities. They don't want to do anything. Okay. You're assessing patient with who's taking haloperidol, Haldo, for schizophrenia. What finding should be reported immediately, right away? High priority. Now, other things relevant as well, but we're talking about highest priority. Yes, C is the correct one. Involuntary muscle spasm. They have a stiff neck. They're smacking their lips, or you see tremors. That is something high priority, should be reported to the doctor right away. what these symptoms are called if they're having these involuntary muscle spasm, lip smacking, stiff neck. What is called?
Extrapyramidal.
Yeah, good job. EPS or extrapyramidal symptoms. That's a known adverse side effect related to these drugs. Okay, because this is an old generation drug, and old generation, the first generation, they have a lot of EPS, extrapyramidal symptoms, unwanted. And Haldol stays in the system for many, many days. Now here is another depression drug, fluoxetine, brand name Prozac. Which statement indicates need for further teaching? I understand it may take a few weeks before I feel the full effect. Absolutely correct. These are not quick fix things. I'll take my medication in the morning to help prevent insomnia. Does this drug cause insomnia or drowsiness? What does it? Is that correct? Yeah, it can cause insomnia. That's why it should be taken in the morning. And this also stays in the system for longer. So this drug also requires a longer washout period if you're switching between different antidepressant drugs. If you have to switch from fluoxetine to others, you may need an extended washout period. Okay, so C is the correct one here. Should never stop taking the medication immediately. They may not eat it at some point. They may need can be discontinued in some cases. Okay, and should be tapered. Usually these are long-term therapies. Okay, and these drugs carries a high risk, especially when they're started. So first 2-3 months, and in teenagers, high risk of suicide. Okay, next. Okay, nice. Yes, B is the correct choice. The patient, it's a known thing that the patient may have a decreased sexual desire. So decreased libido, those are known adverse effects associated with this medication. So, but it's not the reason to stop it immediately. It's not something unexpected. Okay. Now here your patient has rheumatoid arthritis. You're giving them immunosuppressant, methotrexate. Which statement indicates they need more help? To clarify something. So methotrexate always reduce absorption of supplements, right? Folic acid. So they need supplementation. That is correct one. Fluid intake, yes, should be increased to prevent the kidney damage. Otherwise, your patient can damage the kidneys. Avoid alcohol, absolutely yes. So the right choice here is D. Trying to conceive while on methotrexate, that is not correct. It can cause fetal harm, miscarriage. Okay, the patient should avoid getting pregnant, for at least if it's a man, then say that should not be involved in sexual activity for or trying to have a baby in first 3 months. But if the woman is taking it, they should not try it at least for 6 months. after stopping the medication. Okay, next. Same drug, methotrexate. What labs should monitor? What is important? Now, this drug is an immunosuppressant, right? So it's an immunosuppressant. It is going to suppress the immune system. And which cells are responsible? WBC, right? So how do you test them? Well, you can do CBC or show up, right? So CBC, liver functions are also very important with them because this drug is hepatotoxic. Not good term, not in good terms with liver. So we need to monitor that. Creatinine, C. Why? Because methotrexate is cleared through kidneys. Okay, so you should monitor. This is a toxic drug. You always monitor. Then your D, platelet count, because this drug can cause what? Thrombocytopenia. Why? Because of bone marrow suppression. So your patient might be at increased risk of bleeding. So you need to monitor these things. Everybody good? Yeah.
A, B, C, D.
Yep.
Thank you.
Well, okay. Now patient is on tamoxifen for breast cancer. Who needs further teaching here? Tamoxifen can cause hot flushes. Yeah, okay. Important to educate your patient that, yeah, they experience hot flashes, but it's no. You should keep taking it. The correct choice here is da-da-dee-dee-doo-doo. D is the correct one. Okay, not to stop as soon as they start feeling better. They need to take it for the full prescribed duration. It could be somewhere from 5 to 10 years. Okay, if they stop the medication prematurely, they're putting themselves at risk of cancer progression. Okay. All right. You're providing the start teaching to a patient at a kidney transplant, organ transplant. They're given cyclosporin, which is an immunosuppressant. Who needs help? Please clarify to them. Okay, C is the correct choice here. Stop taking this medication if I start feeling better. No. Your body is going to reject the organ if you stop taking it. You gotta keep taking it. Because body will see it as a foreign invader. I'll try to damage it. Okay. A monitoring patient taking cyclosporin. What should you report immediately? High priority. Or you can say highest priority, not just a high. So if you read it, see, first read B and C, like mild hand tremors. We are talking about something should be reported immediately. So mild hand tremor doesn't sound like that. Gingival hyperplasia, it's known for phenytoin, not here, not to worry about. So now here we are between A and D. Increased blood pressure, that could be a problem. But is there anything more important? Elevated creatinine level, what they're associated with?
Kidneys?
Kidneys, right? That is more important. That's a vital organ.
Is it nephrotoxicity?
Yeah, this drug is nephrotoxic. And this poor patient already had a kidney transplant. We don't want to damage their newly installed kidney, right? Okay. Patient going through chemotherapy. What should you report? Immediately. Nice, nice, wonderful. Good job, good job, good job. I'm proud of you guys. Yes, but can you tell me why temperature is important here?
The chemotherapy is not gonna work if the temperature is high. I think it's gonna suppress or something.
It could be an allergic reaction to the medication as well.
High temperature is not indication of allergic reaction. What else? What can you think of?
I think the medication, their body is gonna reject the medication if they have fever.
Infection.
Infection.
Depression.
Yeah.
So it's telling infection, right? So why
Because they're
chemo
immunocompromised.
suppresses the immune system and increasing risk of neutropenia and life-threatening infections. So high temperature could be an indication the patient is experiencing the neutropenia and maybe they have severe infection. They require immediate medical attention. Now, as far as mild nausea, fatigue, who cares about mild nausea, fatigue when they are going through chemo? That's known. Not mild. I mean, they'll be thankful if it's mild. It's usually severe. So alopecia, dry skin in the beginning, yeah, that happened. That's known. Loss of appetite, weight loss, that's known. We are worried about getting somebody infection, severe infection, whose immune system is already so weak. They're at high risk. That's what should be reported immediately. Yes, you guys with me on that? Are we on the same page? Why it's important? Remember, some questions, there are multiple options which are correct, and they may ask you what is the highest priority. Okay. Patient had kidney transplant. They are on immunosuppressive therapy. Who do you think understand here correctly? Which statement is, excuse me, correct? There's immunosuppressant strengthen my immune system to help my body to accept the new organ. So it's like half correct. It helps to keep that organ, but not by strengthening the immune system. It's by suppressing the immune system, right? So that's not correct. These medications prevent my body from attacking the transplant organ by suppressing the immune response. That's what happens. Body thinks it's an outsider. So let me go fight. Right? So it suppresses the immune system so they do not see it as a foreign enemy and try to push it out, right? Reject it. So that is the correct one, B. And these medications are taken like all their life. not for a few months or things. Now here, patient with kidney transplant, asking how immunosuppressant medication work. Well, we know that they kind of try to suppress the immune system so they don't reject the organ, but which cells are involved? Nice. You're 100% correct. T cells, T lymphocytes, they're the ones. Okay, next. Let's speed up a bit, guys. It's about 6:50, and we are at slide 40, and we have about 130. So please try to answer quick. Come on, come on, come on, come on. Okay, the answers are mixed up here. So C is the correct choice here. Okay. Nurse providing education, undergoing chemo. Which statement patient indicates a need for further teaching? I will take my anti-nausea medication only if I start vomiting. No, you start it early. Otherwise, definitely they're gonna have nausea, vomiting. That needs further teaching. They should wash their hands so that and prevent large crowds. Why? Because their immune system is weaker, they can get sick, right? That's why hygiene and prevent going into crowds. Use a soft bristle toothbrush, avoid flossing. Yes, that is correct. C is something which needs more clarification. Okay, the patient is on heparin for DVT, deep vein thrombosis. Which lab value should monitor? Good job. Yes. B, APTT, partial thromboplastin time. Good. Okay. How about this question? So patient is on heparin for DVT. You check their APTT, which is 110 seconds, normal between 30 to 40. What should you do first? Now remember, what NCLEX want you to do. Keep your patients safe and do not hurt them anymore, right? So what is hurting them? Heparin, too much heparin. So how you stop that? Well, you stop the troublemaker, heparin. So you stop heparin and now manage the problem. Too much heparin neutralized by giving who doesn't like them protamine, right? Antidote. Okay.
Thank you for your tip. It did work. It worked.
Yeah.
HP and
HP?
weak. Yes.
Yeah, it will always work. Just remember it.
We'll never forget.
Yeah, you won't forget it. Even after 20 years, you will know it. All right. Patient on warfarin, AFib, who needs further teaching? Come on, come on, come on, come on, everybody. All right, good job. Yes, 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 yes. C is the right choice. I can eat as many as green leafy vegetables as I want since they're healthy. Well, they are healthy, but maybe not for you. What is the reason, guys?
Bleeding.
Yeah,
Vitamin
because
K.
it's high in vitamin K and weak WK. They go against each other. Okay. You know, patient taking warfarin. Patient's INR is 5.5. They report mild bleeding from their gums. What to do? All right, so did it work again, guys? Yes. Weak, right? Weak. WK. Warfarin and vitamin K. Administer vitamin K. What is the normal INR?
2 to 3.
2 to 3. Excelente. All right, next. Somebody has a prescription of heparin. Heparin goes sub-Q. Which statement needs further teaching? Is A is the correct choice? Inject the medication into abdomen, right? In an abdomen and about 2 inches away from the belly button, right? That's the right spot. Same for the insulin. I should rub the injection site. Ooh, ooh, ooh. No, 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 no. And no, and no, and no. No, 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 no. No rubbing, right? Use a different injection site each time. Yeah, that's what say. Like rotate the site of injection, right? Monitor for signs of unusual bleeding. Absolutely, yes. Patient high risk of bleeding. Well, you're gonna monitor what the risk at. So correct is B. Next, patient is gonna take prochlorperazine. It's a phenothiazine. Nausea, vomiting. Who needs teaching, teaching, teaching? Great. Yes, everybody answering correctly. C. Not immediately stop. Why? That's a known side effect with that drug, right? They can just you can educate them to manage those symptoms by staying hydrated and kind of using sugar-free gum and all that. They don't need to stop it, but it's important you tell them rise slowly, sit before you stand, because risk of fall, hypertension, right? Possible hypertension. And absolutely right, B, that they're going to experience drowsiness, shouldn't drive. And if they experience muscle stiffness, unusual movements, it should be reported. The reason, EPS, extrapyramidal symptoms, right? Or side effects. So those are important. So C is the right answer. So caring for a patient has severe vomiting. What's the priority assessment? Nice, yes. A is correct here. What happens in vomiting? You're losing fluids and electrolytes, and that's what you need to monitor. Okay. Have you ever heard about acidosis, alkalosis, respiratory and metabolic? It's related to that. Somebody is having vomit. Okay, they're vomiting, prolonged vomiting. And you're looking at ABG values. So you need to know Acidosis, alkalosis. Acidosis when pH is low or high in
High.
acidosis.
High.
Is that right, guys?
For acidosis less than 7.
Or low.
Okay. So alkalosis is when pH is elevated, usually above
For alkalosis more
7.45.
than 7.
Okay. And bicarbonates are above 26. So A is the correct choice here, where pH and bicarbonate, they're both high. That's alkalosis, too much base. Okay. When pH is high, that means it's basic. When pH is low, that means acidic.
Mhm.
Okay.
Professor, can you say that again? You said low for acid, high for.
Yeah, when pH is high, remember, like, these days people say, oh, drink this kind of water, it has higher pH. That means it's more basic. Okay, if they drink water, right, the pH value is low, it's going to make it more acidic. Now you give them ondansetron, a 5-HT3 receptor antagonist for nausea, vomiting, Zofran. So which statement is incorrect? Well done. Yes, D is the correct answer here, because they cannot take other drugs which does the same thing, which this does. It's a serotonin receptor antagonist. Okay, and if you use another drug, that's a big problem. It can cause serotonin syndrome, too much serotonin. If they're taking like a depression medication like SSRIs, SNRIs, monoamine oxidase inhibitors, they shouldn't take it. Okay. Next. Passive scope patch goes right behind the ear for motion sickness. Which statement requires further teaching? As I said, goes behind the ear, and yeah, somewhere 2 to 4 hours before you travel, it should be applied so that the drug is in the system before they start traveling. I can cut the patch in half if I need a lower dose. You don't cut the patch. No, you don't cut this patch. I've seen one patch they can cut is usually that's your lidocaine patch. Other patches shouldn't cut it. Avoid alcohol, yeah. I may experience dry mouth, yes, they can, but you don't cut it. It makes your patients same thing, a slow, sleepy, drowsy, dry. Okay, patient given verapamil for hypertension. So there are 2 drugs in this class, right? Diltiazem and verapamil. Who needs further teaching? Which one is incorrect option here? So they should not take grapefruit juice. It will increase verapamil level. It can cause toxicity. Monitor heart rate, yes, absolutely. And if they experience constipation, which is a known adverse effect with calcium channel blockers, and will increase, they should increase the fiber fluid intake, but do not abruptly stop. Do not stop them if it's normal. You got to keep it normal as well, not just to achieve it once. Okay, you're monitoring, once again, patient on verapamil has hypertension. Which adverse effect most concerning? It might be more than one, but what is most important? Okay, wonderful. Bradycardia. Now, patient has hypertension. Hyper, high, right? So what could be concerning? Going down, slower, bradycardia. Okay, patient is on hypertension medication, Rapamel. The reports dizziness and all that. The blood pressure 88/56, heart rate 52. What's the priority? Once again, do not hurt them by not giving them what is hurting. So it's the medication. So hold the next dose, call the doctor, right? Hold those, call the doctor. Okay. About patient on diltiazem for AFib, what requires immediate attention or intervention? Once again, what is this medication diltiazem? You're giving it a patient who has hyper, right? Tension. So it is going to bring it down, lower it. But if it's already lower, that requires attention. So blood pressure is low, 88/54. Well, that's a problem. Okay. Patient is on amiodarone. Which assessment is most important? Okay, so we're lost in this question. The correct choice is B, thyroid function. The reason the long-term use of amiodarone can cause thyroid dysfunctioning. It could be hypo or hyper. The reason behind that is amiodarone contains iodine. Okay, that is a problem. So your patient needs regular monitoring of your thyroid tests, like your T4, T3, TSH. Those should be monitored. Okay. Next, patient on amiodarone. Now here, or will be on actually. So what is priority before administering this medication? The patient is due. What is important here? Yes, absolutely right. Good job. A is the right choice here. Assess the patient's blood pressure and heart rate because it can cause bradycardia, hypertension, right? So that's the priority. First, know, is it safe to give it or not? And we can only know by assessing the patient. All right. Everybody's doing okay? Jared, you look sleepy. You tired? Yeah? Sublingual nitroglycerin, guys, for angina. Looking for incorrect choice. It's a sublingual, goes under the tongue and dissolve on its own. And if chest pain is not relieved after one, they can take another one after 5 minutes and another one after 5 minutes, right? But should not swallow it whole with sip of water. So C is the right answer, but incorrect statement. Okay. Same drug, sublingual nitroglycerin. Which one is correct? Good, excellent. Good job, guys. B is the correct choice here. We just talked about it. Next. It's about nitroglycerin, which requires further teaching, which is incorrect. We'll always keep it in dark, tightly sealed container, always away from direct sunlight. And we talked about how many to take or interval. And you're absolutely right. C, it should not be taken with ED drugs. What is the reason? Why
The
can't
blood,
be taken?
the blood,
Sorry, say that again.
their blood pressure can drop.
Yeah, hypertension, severe. Okay, nitroglycerin patch. Who needs further teaching? Always apply to hairless area, rotate the side, remove the patch at bedtime, because if you apply it continuously, the patient will develop tolerance and they won't respond to that anymore. But you should not cut the patch. So D is the right choice here. Okay, next, patient will be taking furosemide Lasix, which is a diuretic, right? And who do you think is not understanding here? Yeah, good job. B. Nobody, they should not skip a dose. They should not double dose either, right? So B is the right answer here. And okay, here you go. It's about beta blockers. Beta blockers given to hypertension patients, right? So blood pressure high, this is gonna drop it down. So always educate them, sit before stand, right? Avoid getting up too quickly, can cause hypertension. They cannot or they should not stop taking the medication when they feel better. They should continue it, same time every day. B is the right choice here. Now here, patient is given a beta blocker. Which condition is a contraindication? Good job. Yes, B. COPD or asthma. These are respiratory conditions. The patient shouldn't take it because it can cause bronchoconstriction, right? Bronchoconstriction.
That's for summer.
Okay. Now here, patient taking digoxin, which is a narrow therapeutic index drug. What symptoms are concerning? Okay, majority answered correctly, but there are some incorrect answers as well. A is the correct choice, nausea, vomiting. The reason, there might be an indicator of digoxin toxicity. Okay, and you should be checking their serum drug levels because it's a neurotherapeutic index drug. Okay, and they can also experience, what else can they experience? Anything?
The yellow and green vision.
Yeah, visual disturbance, yellow, green hollows. Okay, what should you assess first if your patient experiencing digoxin toxicity? Come on, guys. C is the correct answer here, okay? Digoxin toxicity, first priority to assess the heart rate, as digoxin does what? It affects the electrical conduction of the heart. It can lead to what? Bradycardia, arrhythmia, and other cardiac abnormalities. So you monitor, reach out, assess what is at highest risk, heart. Okay, so patient confirmed digoxin toxicity. What can you give? It's an antidote. Yeah, C is the correct choice here. Digoxin, immune fab, or digibine. That's an antidote for digoxin toxicity. How about patient has asthma? Which statement indicates they are understanding what you are teaching? Should they avoid all exercises to prevent asthma attack? No. You shouldn't overdo, but you shouldn't avoid. Should use my bronchodilator inhaler before using my steroid inhaler. Is that correct? Yeah, always use bronchodilator first because you want to cause bronchodilation. Open up the airways first so that they have better absorption of the next drug.
So
Okay.
what's the right answer, Professor?
It's
B?
a B.
Okay. Thank you.
Now here the patient is taking Advair. It's a combination product, fluticasone and salmeterol for managing asthma symptoms. Which statement indicates need for further teaching? Should they be rinsing their mouth to prevent fungal infections? Yes, because it has fluticasone, right? This medication helps relieve my acute symptoms. Is it given for acute or chronic? Chronic management, right? Not for acute. Those are rescue inhalers. Let me tell you an interesting thing. For NCLEX, do this, okay? For NCLEX, that's the right thing. But there's data, some studies done, which are suggesting that your albuterol alone, given for acute symptoms, has less efficacy as compared to a combination one. Okay, but don't select it for NCLEX. It will take some time for them to update these things when there are more studies, and then they will see at one point that, oh, let's update this. Okay, so I'm just giving you some new information, but don't apply it. It's too early. You may see practically, because when studies comes out, you see prescribers changing prescription habits based on that. Okay. All right. Okay, C is the correct choice here, guys. Okay, C is the correct choice. The reason you're teaching the patient about a albuterol inhaler, and they're saying which needs further teaching. And see, I can use my albuterol inhaler up to 10 times a day if needed. Oh no, that means their condition is boom, boom, boom. Okay, really bad. They need chronic management. They need long acting medications. They can't just keep using albuterol that many times. Those are really worse symptoms. That's usually one of the criteria when you're assessing your patient, the severity or efficacy of the medication. If they're saying, oh, I have to use it too many times, well, we need to adjust the medication. Okay. Okay. Next, albuterol inhaler for asthma. You're telling them about side effects. What is a common adverse effect? Albuterol. Excuse me. Okay, come on, come on, come on. Yeah, B is the correct one here. Tachycardia. Heart rate goes up. Okay, with these medications. They may have tremors in the beginning, mild tremors when they're starting. It should go away after a few doses. Okay. You're teaching a patient how to properly use inhaler. Which instruction is correct here? Do you take a deep breath in and hold your breath for 5 seconds after inhaling the medication? Remember, read the question carefully. They may mix things up. Take a deep breath and hold it. That is right, but not for 5 seconds. The correct is 10 seconds. So half statement is correct, half is not. As far as B, shake the inhaler. Yes. So that drug is properly mixed. That is the correct choice. You should wait at least 30 minutes between each inhalation. Well, no. Who has that much time? Exhale fully, then place the inhaler in mouth and inhale. That's correct. As well. Exhale fully, then place is that you exhale fully before inhaling, but should do so with a slow, deep breath, not rapid. Okay. Okay. Inhaled corticosteroid for asthma. Who needs further teaching? Corticosteroids we just talked about, oral thrush can happen, frequent oral care is important. I can stop using inhaler once I feel better. No, that is not correct. So B is the right answer here. Okay. And spacer, you guys know what spacer device is? Yeah.
Yes.
It's like a plastic tube, right? So it saves the drug from getting waste, right? So it just stays in the tube, has valve, and it doesn't let it go out. And usually kids, it's more effective. And then also with old patient, but kids more importantly, so that they don't lose the dose because they don't know how to synchronize with the breathing pattern with when you're releasing the medication from the inhaler. Okay. Let's speed up, guys. Let's pick up the pace. Once again, inhale corticosteroids. Which one is incorrect here? It should rinse the mouth, right? To prevent oral thrush. Does this medication control acute attack?
No.
Oh, once again, as I told you, that new data suggests inhaled corticosteroid with SABA short-acting beta agonist that's more effective than SABA alone, but forget about it for you. NCLEX? No. Okay. All right. Now, patient has COPD. You're giving them anticholinergic aprotropium, Atrovent, which is an MDI, middle dose inhaler. Okay, the MDI inhaler and DPIs are the dry powder inhaler. So this is the MDI. What should you instruct them? Okay, now remember, MDI, well, you know what, I think I may have mixed up a couple which were correct.
This is not like
Okay, I wanted to, I know it's a little confusing here, but let me explain. For this question, I wanted to show you guys understand an angle about hypertropium class who belongs to those anticholinergic, which makes your patient slow, sleepy, drowsy, dry. So in order to manage the dryness in the mouth, rinse the mouth with water and kind of staying hydrated. That is what I wanted to put in here. Okay, that's the link I wanted to highlight.
Professor, why not A?
That's what I'm saying. It got confusing. I put up more than one option, but I didn't do select all that apply. But in this question, that's what I wanted to indicate. That is a true statement as well. But as I said, I was trying to focus more on that class of medication as a class, what adverse effect they have. Okay.
Thank you.
Wait, sorry, Professor. So what are the right answers? Is it just one or two?
Okay. As I said, there are multiple options which are correct. Okay, A and C. But in this question, as I said, I wanted to highlight the adverse effect associated with anticholinergic medication, which makes your patient slow, sleepy, drowsy, dry.
So it's rinse mouth after use?
So generally, yeah, rinse mouth. It's not for infection or anything. It's more about dryness. That's what I was trying to target here.
Okay, all right. Thank you.
Okay. Patient has COPD, give them ipratropium, anticholinergic. So think about it. Adverse effects of anticholinergic medication, contraindications. Yeah, great. Remember, anticholinergic, right? Anticholinergic, ring the bell. Think about Benadryl, slow, sleepy, drowsy, dry. Patient with BPH, glaucoma shouldn't take it. And that's why you should assess the history of glaucoma before giving it, because the whole class has that issue. Make sense? Okay, next. The patient is going to take DPI, dry powder inhaler. Which statement indicates the teaching was effective? Which is a correct statement here? Like there's so many ghosts. Guys, where did you disappear? There's so many cameras off. Where are you? Come back. Okay. Here, D is the correct choice, guys. They should inhale quickly and deeply. When it's dry powder, it needs more suction power. Okay. When it's meter dose inhaler, it's the drug compressed in that small container, and when you press, it's ready to jump out. You don't need extra effort to bring it out. But when it's a dry powder, you need more suction, more power to pull it out. That's why inhale quickly and deeply to get the full dose. Right? Everybody understood the point? Any question? Yes, cabinet D.
Should it not be shaked, Professor?
It's not really required. It's a very, they are microparticles. They're very tiny. They don't kind of lay down, sit down tightly that you need to vigorously shake. You know, it doesn't hurt. Minor, you just move it, but you don't need to like shake it.
Okay, thank you.
Theophylline is a bronchodilator, and it's one of those drugs with narrow therapeutic index. Yeah, it can cause tachycardia. So B is the correct choice here. That's a common side effect associated because it can stimulate the CNS and increase the heart rate. Next question. Theophylline for COPD. Which of the following the patient should avoid when taking this medication? And it's pretty much associated with the previous question. So in the previous question, the answer was what? Tachycardia, right?
Is it
Now,
A?
which one causes? Yeah, A, coffee. Tachycardia, same thing. Has caffeine, right? And another thing, when your patient is consuming any beverage which has caffeine, one of the biggest concern that it can increase the level of theophylline in the system. And theophylline is a narrow therapeutic index drug. A slight variation could be a big problem, right? So that is more important. Is the correct choice here. Next, loperamide, Imodium for diarrhea. Which statement indicates need for further teaching? And guys, please try to answer quick. Correct. Okay, B is the right choice. It should not be continued indefinitely a daily basis. No, it's only when needed. If they don't have diarrhea, no, they should not be taking it. They should stay hydrated. And if the symptom doesn't improve, they should see a doctor. That is 100% correct. But not to take it every day. Okay, now here's an antacid for heartburn. Okay, which one can cause diarrhea? So there's some can cause constipation, some can cause diarrhea. Okay, great job. Yes, absolutely right. Now, remember, magnesium starts with M. Movement starts with M. Magnesium causes movement, means diarrhea. Okay. On the other hand, AC, AC, okay, goes together. Air conditioner goes together. AC stays together, ends with C, causing constipation. AC causes constipation. Okay, aluminum and calcium, they causes constipation. Magnesium causes movement, means diarrhea. Okay, a little tip to remember them. Now they're asking here, the patient is asking, how does Docusate sodium works? They had constipation. You're giving them Docusate, but they don't know how it works. And you're looking for incorrect one here. Further, we did further teaching. When it's constipation means dry. Solution is making wet, and you need water for that. So always a lot of water, right? But this medication is not a stimulant. It does not stimulate the bowel. It's a stool softener. There's a different mechanism of action. And yes, it can take 1 to 3 days before the bowel movement. Okay. And I will not use the medication for more than a week without consulting. Yeah, absolutely right. There may be something underlying cause or other things. But B is the correct answer here, or you can say the wrong statement. Okay. Okay. Patient is on Docusate sodium. What is the rationale behind it? If somebody it just got out from surgery, isn't it like after surgery they need like pain medication or something? Why they're giving them stool softener?
Reduce. Oh, never mind.
I'm sorry. Say that again.
No, I take it back. I changed my mind. Sorry.
No worries, no worries, no worries. Okay. Yes. See, when your patient coming out from surgery, number one, most likely they'll be on an opioid, right? For pain. Opioid causes constipation, right? Now they'll be on the bed. They're not eating well. They're not drinking well. Well, constipation becomes more worse, right? Now, in order to have a bowel movement, what they're going to experience, well, they need to push harder, right?
And they're gonna strain.
More strain. And you don't want that. There shouldn't be any straining. So that's why you're causing this stool, making it soft so that they can pass the stool. Okay. All right. Next. Patient has been given ranitidine, Zantac, which is H2RA, histamine 2 receptor antagonist for GERD, right? Gastroesophageal reflux disease. Which one seems incorrect here? Okay, the right answer is D. Okay, let's talk about why. I can stop taking this medication once I start feeling better. Now, they should continue the whole course. Okay, continue the whole course, not as soon as they start feeling better because they have GERD. Now, going back to other options, I should take this medication with food to reduce stomach upset. Yes, that is correct. Usually in the evening, right? I can take this at bedtime. Yeah, absolutely correct. Should avoid smoking while taking this medication. That is also correct because smoking can increase the gastric acid production and reduce the efficacy of the medication. Okay. All right. Now, same here. H2RA histamine 2 receptor antagonist for GERD. Which one indicates understanding of the medication's therapeutic effect? Does this medication increase the production of acid? No. It works by neutralizing stomach acid and reducing heartburn. Does it neutralize? It's a histamine 2 receptor antagonist, right? So C is the correct choice. Histamine receptor antagonist or blocker. So they block histamine receptor, and C is that's what it's telling. Histamine 1 receptor associated with allergies, histamine 2 receptor associated with acid, and that's what they're talking about. Next, let's talk about PPI, proton pump inhibitors, which ends with prazole, like pantoprazole, omeprazole, esomeprazole, those ones. Which statement indicates need for further teaching? Is A correct? Taking it in the morning? That is correct.
Yes.
PPI should be taken empty stomach, right? I can take this medication with any food. Is that right? No, 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 and no. I should avoid taking antacid within 1 hour of this medication. Absolutely correct. Shouldn't. I should notify the provider if I experience persistent diarrhea. Absolutely, yes. Maybe something else is going on. So the correct answer B, which is a wrong statement, right? Next. Patient is given or prescribed lactulose. Okay, lactulose. Why in patients with hepatic encephalopathy? Nurse should prioritize which of the following assessment before administering lactulose. What is the important part here? Yes, absolutely right. Proud of you guys. Yes. Lactulose is given to pull the ammonia and converting into ammonia, which can be excreted out, cannot be reabsorbed. Okay, these patients have high level of ammonia, which is dangerous. So lactulose helps to reduce the serum ammonia level in these patients. Okay. Because it's a liver disease, hepatic, it's a liver disease. Liver is not healthy, and liver is the one which converts that and ammonia to urea for excretion finally, but because it's experiencing issues, that's why you're giving them lactulose. Okay. Yeah, they're talking about laxative. Hey, come on, everybody try to answer, guys. I think you are experiencing fatigue. Right. Shake your head and start answering. Okay, yeah, B is the correct answer here. I can take the laxative every day. Oh no. Laxative should never be taken every day. Always for short period. Okay. Okay. Now you're providing education to a pregnant patient, prescribe a laxative, castor oil. Which statement is correct for the patient who's pregnant? Castor oil is safe for use throughout pregnancy to relieve constipation. Is that correct? Castor oil is contraindicated during pregnancy because it can cause uterine contractions. You don't want premature early contractions, right? Only when they're due to deliver the baby. So it's contraindicated. Okay. Now here, it's about sucralfate. Patient has peptic ulcer disease, has ulcers. Which statement describe the correct mechanism of action of sucralfate? How does it work? In A, they're saying sucralfate neutralize stomach acid. No, neutralize, those are antacids who neutralize, right? When you have too much acid, you give them a base, which is antacid, like sodium bicarbonate. They neutralize. Sucralfate, think about it. You know, you have like a cut or something, right, on your skin, and you put a Band-Aid on it so that you can prevent contact with anything which can make the cut more worse, right? It can hurt more, right? If you touch something or anything, you know, say even food like spicy food, well, it's gonna burn. Alcohol, that kind of stuff. So it's same way, sucralfate makes a thin lining, a protective lining over the ulcer so that the acid does not go and make the ulcer worse and eventually bleeding, right? So they are covering it up, okay? It forms a protective barrier. B is the correct choice. Okay, now here, patient had PUD, peptic ulcer disease, sucralfate prescription. Which statement indicates further teaching is required? Should they take the medication empty stomach before the meals? Yeah, right. Why we are giving it? To prevent the contact of acid with ulcers, right? And when body release more acid after you eat to break it down, correct? So it should be taken before so that when the acid is released, it's ready to prevent, right? So the correct answer or the wrong statement here is C, that I can take antacid with sucralfate to relieve any stomach discomfort. Ooh, no, no. Okay, next. Patient has been given bisecodil, Dulcolax, right? Constipation. Which statement requires further teaching regarding the adverse effect associated with this medication? When somebody's constipated, that's an important part. They should drink plenty of fluids, right? So A is correct statement. Bisecodil can cause abdominal cramping, which is normal and should go away after a few uses. It's not normal. It can happen, but it's not normal. So B is the right answer or the wrong statement. Okay, so it's kind of a mix up. Yes, patient, because stimulant, it can cause abdominal cramping, but it doesn't mean if it's happening that it's normal. And always, stimulant laxatives should not be used more than 3 to 5 days. The patient may develop bowel dependency. They may not able to pass the stool if they use it for a few days. Right? And anytime if there's a bowel obstruction, perforation, these should not ever be used. Okay, now if you give a patient who has constipation a laxative, okay, then potential adverse effect associated. Yeah, so laxative can cause electrolyte imbalance, especially low potassium level, hypokalemia. So B is the correct choice, okay? Because when you give them laxative, they increase the bowel motility, the movement. It can lead to excessive loss of potassium through the stool. And potassium is a crucial electrolyte for muscle functioning, including your heart. And when they take this and hypokalemia happens, it can lead to muscle weakness, cramping, or cardiac arrhythmias. So it's important to keep an eye on that. Okay, here comes your calcium carbonate, which is an antacid, right? For heartburn. What should you include in the teaching? Now there's a little conflicting information here, so let me clarify that C can be, it's kind of close, that yeah, it's for acute and should not be taken continuously, so only when you experience symptoms of heartburn. But here the more important part, what we are doing here is B, that antacid general instruction, never ever take with any other medication at all. Okay, because it will reduce the absorption of any other drug you take along with it. Okay, that's what I want you to know. Next, the patient on morphine for pain after surgery. What is the most important nursing action before you give them morphine? They can ask you the most important or highest priority or what's the most common. So just know the difference between them. The most severe issue is the respiratory depression, right? Respiratory rate can go down. So that's most important to first assess the patient's respiratory rate. Is it safe to give it or not? If the respiratory rate is low before the dose, you should call the doctor. Hold the dose, call the doctor. Okay. Next. Now, patient is 75-year-old, opioids for chronic pain management, educating patient about risk of opioid use. Which one is the wrong one here? Further teaching required. Anytime if any medication upset the tummy, it can be taken with food. Okay, and as far as B, using walker assistive devices, definitely recommended because patient is 75-year-old, second on opioid, slow, sleepy, drowsy, dry, right? Weak patient, they can fall. So in order to prevent the injury, it is highly recommended to use some assistive devices. I can still walk around freely without worry as the medication will not affect my balance. Ooh, no. Slow, sleepy, drowsy, dry. Well, no, that is wrong statement here. So C is the correct answer. And need to be cautious when standing up quickly? Yes, because it can cause hypertension. Next. Nurse providing education to patient who has been prescribed ibuprofen NSAID for pain management. Who needs further teaching? Is it normal when to educate patient taking ibuprofen with food? Yeah, because it can upset the stomach. Taking ibuprofen as needed, even if I have a history of PUD, peptic ulcer disease? No, they have ulcer, bleeding risk, NSAID can make it worse. So that's a no-no. Okay, avoid drinking alcohol, yeah, because increased bleeding risk. Okay, so B is the correct answer. Next, patient in emergency department, they are experiencing nausea, vomiting, abdominal pain. Patient said they took 4.5 grams of Tylenol, acetaminophen in a day. You think that's normal? So maybe they're experiencing toxicity, right? What to do? Always look where the problem is. Tylenol's problem is with the liver, right? It's with the liver. So monitor liver functions. And now who's the troublemaker? Tylenol. Are they in safe range? No. Toxic range. If they're toxic, what to do? Neutralize it, right? With what? Antidote. And what is an antidote for acetaminophen?
Acetylcysteine.
Acetylcysteine. That's what it is. So B is the correct answer. Okay, next. Suppose any medication, say, it's metoprolol, ER, or SR, whatever, extended release. Which statement include in teaching to ensure the patient understand the proper method of taking it? Can you crush or chew an XL extended release? No. Some XLs, they may have a line where you can cut it in half. Not all. Some has it, okay? Some. And you will find that one that it has a line there. Those are the only ones you can cut, okay? Otherwise, no. Do not ever crush or chew any other form except which one? IR means immediate release, that there's no coating. That's the only one you can chew or crush. Others, no. Okay? All right. Patient is going for a surgery. We're talking about giving them anxiolytic medication, anti-anxiety. Okay? Which actions most important for a nurse to take before giving that medication? Why we give the anxiolytic? Because the patient is anxious, right? Because yeah, obviously they go for surgery. It's normal to be anxious. And what they do, they make them so sleepy, drowsy, right? So things are going down, heart rate, blood pressure going down. And that's what we need to assess. Can we give it? Right? So A is the correct choice. Okay, next. Here, we're talking about diazepam volume, which is a benzodiazepine for anxiety. Which of the following intervention should the nurse include in the patient's plan of care? Think about what are the risk factors associated with benzodiazepine, and you'll find the right answer. you can rule out things, options here, like say monitor for signs of hypertension. This has nothing to do with hypertension. No, it's going to bring it down, right? Blood pressure is going to go down. If you talk about D, teach the patient to stop taking suddenly. No, nothing abruptly you do. So now here it's B and C, right? Encourage the patient to increase fluid intake to prevent dehydration. Well, make them, you know, slow, sleepy, drowsy, dry, but not up to that extent. The important intervention is about avoiding alcohol while this medication, because they both will suppress the CNS system. That is high risk. So B is the correct answer, okay? All right, now let's talk about some antibiotics. Gentamicin, patient has infection, giving them gentamicin. The patient is taking furosemide Lasix, which is an diuretic. What should you monitor? Excellent. Good job, proud of you. Yes, B is correct. Gentamicin, aminoglycoside, they're known for effect on ears. Okay. Tinnitus, B. And what should you monitor while your patient is on gentamicin?
Ototoxicity.
Yeah, patient's hearing, right? If you're talking to patient and they're saying, what? I'm sorry, can you say that again? Well, think about it. Is that a sign of toxicity?
Yes.
Okay. All right, next one. Here it's cephalexin, okay? Cephalosporin. Patient has infection. Which action is most important to take before giving the medication? Whenever it's about before giving, think about it. Is there a risk to the patient if I give it? And yes, penicillin allergy, okay? That is something to assess first. Okay, next question. Patient is given fluconazole, right? Fluconazole. Which of the following condition is fluconazole commonly used for? Class it belongs to. Okay, good job. Yes. Fungal infections, B. Fluconazole, azole, they are all antifungals. Okay, so they're used for fungal infections. Examples, candida infections, right? They call candidiasis, like it could be vaginal, it could be oral. Those are common ones, okay? Okay, next. Patient on fluconazole for fungal infection, potential side effect or adverse effect. What is the concern here? Excuse me. Okay, nice. Yes. Liver toxicity, hepatotoxicity. So antifungals, they don't have good terms with the liver. Okay, it's a known issue. Okay, here comes a big gun, vancomycin. A severe bacterial infection. Which action should the nurse prioritize to ensure the safe administration? Do you administer it rapidly? No. Slowly. How slowly? What's the minimum time you should infuse?
Over
1 hour.
60 minutes.
60 minutes, yes. Absolutely correct. So if it's given faster, there's a chance patient may experience a condition called red man syndrome, like, above the hips, the upper torso, face, it seems red, all red, right? That's why they call it red man syndrome. And that is the reason that if the infusion is faster, okay? Now, we know if it's given faster, patient may experience red man syndrome. As a nurse, from what you know, what can you do first on your own?
Monitor the patient.
Stop the infusion.
Okay, and remember, usually what we
Slow
do,
down the infusion.
do not hurt them, right? But this is known, okay? This is known that it's happening because of faster infusion. Once again,
So we slow
common
down the
sense.
infusion.
Slow it down, right? Slow it down. Most likely, after a few minutes, patient will feel better, but there's a high chance that when you slow down, you call the doctor, hey, this is what happened, and this is what I did. I assessed the patient, this is their blood pressure, so, and the doctor may say, give them antihistamine, okay, like Benadryl stuff to make them feel better. They might be itchy and all that, right? And also, if the patient is experiencing more severe symptoms, if there's respiratory issues as well, you may get an order for like steroids as well. Or if it's respiratory issues, you may have to get them a bronchodilator. Okay. Next. Vancomycin.
I'm sorry, Professor. So you say when it's like severe allergy reaction, do we stop the medication?
Okay,
No, we
remember,
continue?
if it's severe, then you stop, okay? But if they're experiencing signs and symptoms of Redman syndrome, mild, you see that, yeah, it looks like Redman syndrome. First thing you should do, slow it down, okay? But if you see the patient experience severe symptoms, which includes respiratory issues, then you stop. Okay?
Thank you.
All right. Okay, come on, guys, come on. Answer, and please answer. Yes, you answered A. That is the right answer. Okay, A. Vancomycin is nephrotoxic. Watch kidneys. Always. Vanco. High risk. Narrow therapeutic index drug. Big gun, big problem. Watch kidneys. Okay. What it's used for in hospitals usually? What's commonly used?
MRSA?
MRSA, yeah. Big enemy, big gun, okay? Comes with big recoil, right? So watch for nephrotoxicity. Okay. Ciprofloxacin, antibiotic, which is a fluoroquinolone. Somebody has UTI or preferred. Need for further teaching. I should avoid taking this medication with dairy products. Is that a correct statement? Yeah, because dairy products has what? Calcium. Calcium can bind the drug, reduce its efficacy, right? I can exercise as usual, even if I experience some muscle pain. Is that right?
No.
What's wrong with the muscle pain? What's wrong? What is the problem?
Do they call it tendon issues, something like that?
Yeah, tendon rupture or tendonitis. That is a problem, especially older patients. So they should not get involved or engage in vigorous physical activity. And if they experience the muscle pain, they should report that to the doctor immediately. Okay. Okay. Now here is a drug metronidazole for GI infections. Okay. Which statement seems like incorrect? Should they avoid alcohol? General. Yeah, always, right? Pretty much all. But they're at a very high risk if they drink with metronidazole. It's called disulfiram-like reaction. They are gonna experience doomsday. Okay, they're like, oh my goodness, we're not gonna survive today. Real weird, severe symptoms. Everything's spinning. They are kind of palpitations. They're sweaty, nausea, vomiting. They don't know what's happening with them. Okay, it's a severe reaction. So at least like 48 hours after taking this drink. And then the correct choice here is C, that I can take this medication with dairy products to reduce stomach upset. No. Okay. It can interfere with absorption. Okay, now here, amphotericin B. It's an antifungal, a big gun, okay, usually in hospitals. What should you monitor? As I said, you got big guns, but a big recoil as well, so issues as well. And you're absolutely right. It is nephrotoxic. Amphotericin B, how gentamicin is, same way. Nephrotoxic. Monitor kidneys. BUN, creatinine, that's what you should be monitoring. Okay, next.
Sorry, Professor, what's the answer for this one?
Nephrotoxicity, that's to monitor the kidney functions, you monitor BUN, right? And serum creatinine levels. Patient diagnosed with malaria, taking chloroquine, experiencing nausea, vomiting, headache. What are the, so which symptoms are associated with adverse effects? What is the biggest concern if they are taking chloroquine, or if it says hydroxychloroquine? What is the biggest concern here?
You can call jaundice.
Sorry, say that again.
Call jaundice, right? Maybe.
Jaundice, okay.
So about liver toxicity.
Okay. There's enough evidence, data, that chloroquine, hydroxychloroquine, these anti-malaria drugs can cause retinopathy. Okay, it's a severe known adverse effect, usually with high dose. It can cause visual disturbances and the patient may lose vision. Okay, now as far as like nausea, vomiting, those things headache can happen as well with that, but we should be worried about retinopathy here. In some cases, but that's rare, hepatotoxicity can happen, but that's not a high priority because that's not common. That's very rare, but retinopathy is well-known issue associated with these drugs. Okay, D is the correct choice, yes. Okay, a patient given chloroquine, same drug, which of the following statement indicates further teaching is needed? This is a general concept. Do you take this drug as needed, or there's a course what you need to complete? They need to complete the entire course, right? So D is the correct answer. I can stop taking medication once my symptom subside. No, they need to complete the full course for the medication to be effective. All right. Now in this question, they're asking, like, when do you take it? Like somebody's going to a region or country, a part of the country where they might be risk of getting malaria, but when should they take it? When should they start taking? All right, 100% correct. A, 1 week before the travel. Some formulations, they say 1 to 2 weeks, some 1, some 2, but that's the general criteria to start the medication. Okay. And they may continue it even 4 weeks or 4 weeks after the return. Okay. Malaria, given
sorry.
combination therapy.
So 1 week before travel, and then 4 week after when they come back from the travel.
So majority of the drugs, they start 1 week before they travel, but
Okay.
there's some formulations which can be taken for short period as compared to the one we were just talking about, that they have to even continue for 4 weeks after return. Okay.
Thank you.
Yes, correct. When you give a combination therapy, what you're trying to do here is that you want better coverage and less risk of developing resistance. Okay, when you give multiple drugs, then you are keeping their doses low, but making it more efficient by targeting the different steps of their life cycle. You know how your antiviral drugs or antiretroviral drugs used for HIV/AIDS, right? The multiple, right? 3, 4 drugs taken together, because you're targeting the virus at different steps so that you can make it weaker at every step, right? It's like putting up checkpoints. So same here. When you give multiple drugs, you're targeting them at different spots. Okay, tuberculosis drug. Okay, what should they emphasize? Once again, general criteria. Excuse me. All right, nice. B is correct. The patient may start feeling better after a few weeks, but they need to be highly compliant, not miss any dose. Okay, it's a very high risk condition, and they have to take it for the entirety of the course. Okay. Okay, now a tuberculosis drug, rifampin. There are 3 in this. Together, they usually go, one or another. Rifampin, rifabutin, rifapentin. These are 3 drugs that one or another can be used. Rifampin is the most common one. Which of the following statement needs further statement? Further teaching. So drugs starting with R. Rifampin, rifabutin, rifapentin. Remember that RR. These drugs causes RR, changes the color to reddish orange, okay? Changes the secretions color, like urine, saliva, tears, and all that changes sweat. So I should avoid taking rifampin food to improve absorption. Need to notify doctor if I develop any yellowing of the skin. Yes. So B is the right answer here. And I should avoid taking rifampin with food to improve absorption. Okay. Next, rifampin for tuberculosis. Patient is taking COC, combined oral contraceptive, for birth control. What should you advise? What's the connection? Perfect. Oh, great. I am proud of you guys. Well done. Yes, rifampin can decrease the efficacy of oral contraceptive. So they should be using additional measures, right? So C is the correct choice. Okay. Now, another drug from that tuberculosis RIPE therapy, RIPE, right? We just talked about rifampin. Next is isoniazid. The nurse also informed the patient about importance of vitamin B6 supplementation. Why? Why it's so important? Okie dokie. All right. Yes. Isoniazid suppress the absorption of vitamin B6 in the tummy. Okay. So your patient needs supplementation. The reason, if they get deficient, they're going to have nerve damage over time. So in order to prevent that, your patient who is on isoniazid, they should be taking vitamin B6 along with that. Okay. Next, that's the next drug in that tuberculosis therapy, pyrazinamide. Okay. What's important here to monitor if your patient is on pyrazinamide? Brilliant, brilliant, excellent. Yes, guys, you are 100% right. Liver function, pyrazinamide has problem with the liver. So you should be monitoring patients' liver functions, which are your ALT, AST, bilirubin. Those are the ones you should be monitoring. Okay. Everybody's doing okay. I know you're tired. It's a long session, but I just wanted to go over these things. You guys doing okay to just continue a little more? Yeah?
Yes.
Please don't hesitate if you need something to drink or something you want to grab, please. Okay. All right, so next, that's the last one, E from your RIPE therapy. Okay, not the last question, from RIPE therapy, ethambutol. What's important here with ethambutol? Nice, yes. B is the right answer or the wrong statement, right? They should not stop taking the medication if they experience headache. But ethambutol starts with E. I starts with E. So those two E's go together. Ethambutol causes problem with eyes, vision. So if they are taking ethambutol, monitor patient's vision. Okay. The reason? It can cause inflammation of the optic nerve called optic neuritis. And patient can lose their vision. Okay. So can cause blurry vision or color blindness. So it's important that you monitor patient's vision. Okay, now in tuberculosis, combination medication. You're educating patient about potential side effects, including changes in the color of their body secretion, all that. Which drug are we talking about here? Yeah, that was an easy one. Yes, rifampin. Remember the drug starting with R, okay? Actually, pyrazinamide also changes the color, but the patient who are taking the drugs starting with R, rifampin, rifabutin, rifapentin, that is more reddish orange. But pyrazinamide is yellowish orange. That's less dense, less dark. Rifampin one is more darker, okay? Now, let's talk about antiviral. Acyclovir, Zovirax, right? For herpes. The nurse should prioritize which of the following instructions when you are providing education about this medication. Yes, good job. Yeah. So it's important you tell them increase the fluid intake to flush the medication out because it can cause nephrotoxicity. Okay, especially the patient, who takes too much of it, toxicity, or if the patient has a pre-existing kidney problems, they're at high risk. Next, patient has recurrent HSV, the herpes simplex virus, right, type 2. They have lesions, painful lesions in the genital area. So the patient is asking about that, how it's treated, which medication. So we need to educate the patient that this is the drug. Okay, well then, yes. B, acyclovir is an antiviral used initially as well as for any recurrent episodes of herpes. For both HSV1 and HSV2. Okay, everything else, they're antibiotics, they're not antivirals. Okay, next. Patient 65 years old, history of chicken pox. They came with painful rash, has fluid filled in there, the blisters, and path a single nerve pain, diagnosed with shingles. Initial treatment, which is appropriate. Okay. B is the correct choice, guys. Okay, B is the correct choice. You are absolutely correct. That you need an antiviral. And remember, you need to educate the patient that antivirals are not going to cure their condition, but it will reduce the severity and cut off the duration, that cut down the length of their illness. If they're going to suffer for 10 to 14 days, it may cut off 5 to 7 days, but it's not going to cure. It's not going to give any quick fix. Okay, and it's important the patient ever had chicken pox, they're at risk of developing shingles when they get old, because this virus can stay dormant, can just sleep in the body, do nothing. And all of a sudden, when the patient is weaker, the immunity is weaker, they're old now, it just pops up and say, hello, how you been, right? And the patient develop pain, nerve pain, killing, one of the worst pains you have, and nothing helps in that. And usually it hurts wherever those blisters were at one point in the nerves, because it lays down in the nerve. That's where it hurts. Okay, next. Patient with HIV. Patient expresses concern about possibility of transmitting the virus to others. Which is the most appropriate response? Says HIV can only be transmitted through sexual contact. There's no risk to others unless you are in protected state. No. You can reduce the risk by taking your medication as prescribed and using protection during sexual activity. That is correct. That is correct. Once you start treatment, you will not be contagious. No, it takes time, and they will still can spread that. Transmitted through casual contact, touching, shaking hands. It's important to avoid physical contact. So B is the correct choice here. Okay. Next, HIV/AIDS. They given Bacavir. Okay. They came with like a rash, fever, mice. The patient suspecting a skin reaction, adverse reaction called SJS, Steven-Johnson syndrome. There are two bad ones, severe skin adverse reactions. One is SJS, Steven-Johnson syndrome. The other is TEN, T-E-N, toxic epidermal necrolysis. If you hear them, that's a big issue. Okay, those are the most severe ones. Which of the following actions should the nurse take first? So you're a super nurse. Super nurse, play safe. Play safe is do not hurt them anymore, right? So hold the dose, call the doctor, right? B, hold the dose, call the doctor. Okay. Next, we're almost there, guys. Okay. Here, patient with HIV, they give an ART therapy, or sometimes you may hear it's called HART therapy, highly active ART therapy or antiretroviral therapy. That's what it's called. The meaning is highly active because you are giving multiple drugs to target multiple steps of the life cycle of the virus. What do you think is the wrong statement here, which requires further teaching? They should take it as prescribed, even they feel better, right? I can stop taking medication once my viral load become undetectable. While it's great that viral load is low and detectable, but hey, you cannot cure this condition. You can only manage it, so you cannot stop taking it, right? So B is the correct choice, or you can say the wrong statement, right? Everything else is correct. Now, let's look into these few slides, maybe 2 or 3 we have. So know how to convert, okay? 1 ml is also called 1 cc, right? 1 liter has 1000 milliliters, right? Or 1000 milliliter is 1 liter. Know both ends. 1 kilogram equal to 1000 gram, or 1000 gram is equal to 1 kilogram, right? Now, 1 gram is equal to 1000 milligrams, or 1000 milligrams are equal to 1 gram. And 1 milligram is equal to 1000 microgram, or you can say, in other words, that 1000 microgram is equal to 1 milligram. Is that right? Yes. Okay, let's look into another slide. Here, the weight conversion. 1 pound is 16 ounces, right? Roughly, say like 454 exactly if you look like the pound, the milligrams, right? 1 kilogram is equal to 2.2 pounds, right? And volume, okay, volume. Now, generally or commonly used, in homes. So let's start from the minimum, okay? 1 teaspoon. 1 teaspoon is equal to 5 ml, okay? And 1 tablespoon is equal to 3 teaspoons. So 1 teaspoon is 5 ml. If it's equal to 3 teaspoons multiplied by 3 is equal to 15 ml. So 1 tablespoon is 3 teaspoons, means 5 multiplied by 3 equal to 15 ml, right? And 1 ounce is 30 ml. 1 ounce is 30 ml. 1 cup is ounce or 240 mLs. And you don't need to memorize this, but I just put it in there. At some point you may need it, okay? How to convert the temperature, like, Fahrenheit to Celsius or Celsius to Fahrenheit, like, you don't need it in your exam, but just put it there, like, for later use if you want to note it down. Okay. And then your time conversion, simple, 1 hour equal to 60 minutes or 1 minute equal to 60 seconds. So these are like common conversions used in nursing calculations. Okay. And that's pretty much it as far as our practice questions. I'll be more than happy to answer any other questions, additional topic you wanted to discuss, anything else you want to talk about, discuss. I'll be happy to go over. Anything, guys? Any of you feel that whatever we discussed today, if you need more clarity in any of them or anything additional?
Professor, for the select all questions, our health assessment says every time there's a select all question, it's always more than one answer. Does that go for this
Usually
exam
that's
as well?
Usually it's a common criteria that whenever it's select all that apply, usually that's not a single one.
Okay.
Okay, anything else, guys? One thing I want to remind you about that your exam, everybody's aware about when it is?
On the 6th, Thursday.
On 6th, and it's in person, right? On campus. And you guys know everything, time, everything, right?
Yeah, on Thursday at 10.
Okay, so make sure you work hard, okay? You got 1 day. That's it. 1 day. I'm not gonna bug you after that. I'm sorry,
2
what was that,
hours.
Denise?
In room 118, not as usual 120. In 118.
Yeah, so that
building 1, yeah.
I think I shared with you, right? Where it is, right? Yeah, because I don't go to campus, so it's them who provide it, and I shared what they provided. That should be correct because I haven't heard anything afterwards. So be there on time, okay? It's your final exam. Don't be late, because when you go late, then it's up to them, and the policy says you're late, they may not let you take the exam. Second, it causes anxiety when you're running late. You're anxious, and when you're anxious, it affects your thought process. And when your thought process is not clear, you end up answering incorrectly, okay? Which makes it even more worse. So please don't do that, okay? So I know you guys have a lot on your plate, but just for 2 days, and it's worth it. Push hard. Think about it, life and death situation. What can you do to survive, right? So it's a survival mode on. Christy's like, I'm tired, let me go. Let me take a break, then I'll talk about survival, right? But that's what survival is called. Forget about how tired you are, how hungry you are, what else is going around. Just tell everybody like, hey, I know you're important, but let me focus for another day, and then I can give you more time, right? I will address concerns, everything else, but give me 1 more day, because I'll be free from this torture from Professor Straw, right? He can't bother anymore, right? So you
Professor, I
unfortunately
think a
have
lot of
to
us, sorry.
tolerate 1 more day.
I think a lot of us was wondering if the final grade will be available soon after the exam, or does it take a couple days?
Okay, I'm not gonna take a couple of days because I know the anxiety. goes with that. Okay. So my intention would be to release your grades as soon as possible, but I need your help. Okay. What is that? I need your help. The reason is that I saw some questions previously in Canvas that maybe some of you were running behind on an assignment, maybe it just remediation or anything else. I want you to prioritize that. If you are missing anything, submit it right away. Okay, submit it right away. If there is something, as you guys mentioned, you were not able to see it, you're not able to access it, submit everything else. Okay, if it's an issue on ATA end and you see it, it's not fixed, forget about just that part. Everything else you complete, put it up. Okay, submit it. I wanted to grade all that by tomorrow. Okay, everything, so that you all have left is your final grades. Okay, so that we don't wait for anything. As soon as you're done with your final exam, and I can take a look and I'll go through that. I'll maybe take a couple of hours or so. If I have everything else all aligned, all graded, I'll post the grades. Okay, so that's
Professor,
what I need your help.
including
What is
the
it?
3 assignments?
Yeah, look, you have final exam on 6th. There are no other assignment. Whatever is due, it's before that.
Okay.
There's nothing which is due after final exam. Right? You don't play league match after playing the finals. Right? Who was that?
That was for me. You know that.
Okay, yeah, so that's pretty much it. And actually, guys, let me share. Okay, if you have time, please go ahead and do that. What was that? The feedback or email or whatever that was. The course feedback. If you can do that, that'll be great. Appreciate that. But let me share my personal email. Okay, I think this is the last session we're meeting, right? Yeah.
Yes. For now.
Yeah.
Or maybe
Okay, another thing, which I like to do that. Okay, I usually do that with my students. What I do is I set up a link, like how we have the meeting link, right? For today, how we have. So I set up the Teams meeting link, and you guys, if you have computer, if you have phone, after the final exam, like sometime that day, we can connect for 10 minutes and see, like, hopefully I can see smiley faces that day, right? All of you. So I know that it's enough torture and you may not want to see my face again. That's understandable, right? That's fair. Okay. I understand. I'm not gonna get hurt with that. So if you are available, okay, and I know that your family, okay, they are waiting for you from so long. I don't want to steal that time anymore. So please don't sacrifice those moments. Yeah, you really deserve those moments with them at that point. But if you had time, I'll set up something and we can meet. And as I said, like that's the most rewarding thing for me. um, I'm sitting here. I don't expect anything else from you. Which gives me happiness is that when I see smiles on your faces, when you're successful and you proceed and keep moving forward and then you achieve your goals, that's what gives me happiness. So just that. If you had time, uh, I'll be there to see you guys. All right. I know you're stressed out now, but that's like how it seems like when you're smiling. Okay, so let me share my email here, which is personal email. Sometime when you are done with something, you can't access your school email at any point in life, any point in your career, you need any recommendation letter from me, you have any question, you need help, send me an email or call me. I always answer my phone, okay? Anytime. Even I know that it's probably somebody, a scammer, junk, I still answer and say, please don't call me anymore.
Can you teach us other subjects too, Professor, if it's possible, please?
I love teaching, okay, but unfortunately, I don't have more time. That's something because as I said, this is not my primary job. Or this is as I said, like I'm not saying that I don't like the money comes from it. I mean, everybody likes that, but this is something is different than anything else. I have other sources of income, so I'm not worried about that part. I appreciate what I get, but this is more rewarding. Okay. And I'll give you my cell phone as well.
Professor, I know I'm getting ahead of ourselves, but the ATI Med Math, does that pertain to pharmacology? Because we have an ATI exam like next week already.
Okay, man, it's may not be a part of pharmacology alone. I think they separate it out. What does it say?
It just said on the document they gave us, it just says ATI Med Math adult. Yeah.
So it's not part of this course.
Okay.
That's something separate. And med math is just like, as I said, remember I shared with you guys those formulas, the conversion table, right? Master that, and then don't just stick to one resource to keep doing the same kind of variance or same type of calculations, okay? That your learning process becomes stagnant. Okay, when you're a student, don't be stagnant. Learn something new and practice how the questions are presented different ways. Let me share a source with you guys, okay? I don't know if you ever use it or not, but let me share that with you. That will help you not just now, at any point. What is it called? Okay. Sorry, sometimes I forget. I'm getting old, okay? And there's many things runs in my head, and then sometimes I mix up and can't remember what was it. Okay, do you see my screen, guys? Yeah. Okay.
Yes.
And I typed my personal email. Hopefully, typed correctly. Yes, and my phone number, so you can save it. If you are not tired enough yet, at any time you want to talk again, I'll be happy to talk to you guys. Okay. Now here's a website. I mean, it's not comprehensive. It does not have everything, but it has most of what you need as a nurse. Okay. Because you guys are digital age. Okay. As we're in a different world. You guys like online stuff, right? That's why I showed it to you guys. You may like it more than just having that same problems on the book, right? How many times are you going to do the same one? So, for example, if you start from the top, right? Those is question steps. Like you click on it, it will give you junk ad, and after that, you close it. So now it will show you that how to do the steps. Like for example, like if you're doing a calculation of mass for liquid, it will show you the steps, right? So for example, you click on it. So formula, always have your formulas memorized. Okay, it will make your life much easier. Reason, they may throw extra stuff in the question, but if you know the formula, you write the formula, only grab what you need. And you cannot mess up what is going up, what is going down. If you know that the formula says order over have, you're going to find what the order is, how many tablets ordered, and how many you have, what the strength you have, or whatever the order is for. Say the doctor wants 400 milligram, That's the order goes on the top. Bottom half, they have 200 milligram. Well, 400 over 200 means they need 2 pills. Done deal. Anything else, that's a story. You don't need it. Right? So similarly, you can practice these formulas, memorize. They give one example as well, you know, 1 or 2 examples so that you know, and they tell you how to convert each step, right? See here, they said this 0.1 gram is ordered, right? And this is what they have. So the formula says order over half. So order is 0.1 gram, and then that's your 35 over 5. And there are different ways you can do it. I kind of do it in very raw way. I put both values. I put an equal sign in the middle, and then I write the value you have on the left, which is like 30 over 5 ml in this question. And on the right side, I write down what I need to know. So you always have one value, right? One value where you need to know, because they gave you 0.1 gram, but they're not telling you in how many ml. That's what you need to calculate. And I always put that unknown as an X on the bottom of the right values, and then I cross multiply. Once I cross multiply, the next question is which value you multiplied goes on the top and which one goes on the bottom. The unknown value always goes at the bottom, which has X. Whatever you multiply the X with, that's going to go at the bottom. The known values you're multiplying, that always goes on the top. You will get your answer. But that's not the only method of calculating. You can do it the way you are comfortable with. I'm just telling how I do it. Okay. There's no better way of doing than another. It just whatever you develop, but always make sure you develop one method and you follow that. Don't mix and match. Okay. Okay. Now let me give you an example. For example, here, now you learned the method, how to solve it, right? Next is asking yourself, can I do it? How well I understood, right? So now practice questions. Okay. So you can choose the category or you can do random. First, I would say go one by one. Once you master, you feel confident, right? You're doing 8 questions correctly out of 10, then shift to random. Then it will throw random question from different type of calculation. You calculate, say you come up with an answer. Enter, click on check answer. It will not only tell you if your answer is correct or not, but it will show you how to do it. So even if it's incorrect, now it tells you this is the correct method and it's a stepwise approach. So you can match where you were wrong and you can correct it for future. Does it make sense? Right? So you can utilize this to create questions and see whichever the type of calculation you're struggling with to master it. Yeah. So it's called dosagehelp.com. Okay. So please note that down if you want to use it. I typed it in the chat as well, dosagehelp.com.
Really revive.
Okay. So let me, there was something else I wanted to share. Let me just go real quick. Okay. So real quick about the final exam. Okay. You have 75 questions and you'll have 120 minutes, so 2 hours to finish, right? And just to give you a little bit more information, what I generalized in the beginning, the focus more on your 6 and 7 module, right? So you have 12, 19, 23. So about 23 questions or so, somewhere around 20, 25 from module 1 to 5, and the rest, they are from module 6 and 7. So 6 and 7, you'll see you have 6.1, 6.2, 6.3, like that, right? That's how the modules are. So they are kind of spread out in all those modules, but I'm just saying generally, that's how you're gonna see, okay? And I guess that's pretty much it. Do you guys have any other question, concern, anything else you need?
Yeah, Professor, I have a quick question. Are you gonna be able to post this video by tonight or early tomorrow morning, though?
Yeah, sometime, they take a little while to process and save this video. As soon as it's available, I will start the upload. And because this is a longer video, and sometimes it takes a while, but most likely it should be uploaded tonight.
All right.
If there are no technical issues, you're most welcome. Anything else, guys? Any other question? Any other concern? All good.
Thank you so much.
Denise is like, okay, here two, but let me go, right? Take 2, but let me go.
I need some milk and bread.
Thank you,
Have a good
Professor.
night.
Okay,
Thank you for everything.
Thanks,
you're
Professor.
welcome. Good luck, guys. Good luck. Okay, do well. As I said, trust
Thank you.
yourself. Trust yourself and be a super nurse. Okay, super nurse are smart nurses. So we do not only work hard, we work smart. So focus on what you should focus on. Okay, and
Thank you.
think critically means think simple. Okay, think simple. Don't make things complex. It was an honor to teach you guys, spend all these weeks, and I've really enjoyed it. And I can understand if you did not. I know it was brutal. Okay, I know pharmacology. Okay, I'm being just honest. Look, it's about when you deny. I'm not in denial. Okay, I know how bad I am. So I accept that, take that full responsibility for giving headache to you guys. I know how many Tylenols you consume, how many cups of coffee, tea you had to take, right? So my sincere apologies from bottom of my heart. I promise I'm not gonna torture anymore.
Actually, Professor, you actually make us in love with pharmacology. This is the hardest subject in nursing school, to tell you the
That's
truth.
true.
Yeah. Well, I'm glad to hear that. Look, that's your magic then. I guess you guys too good. That's all I can say. I'm not.
You
I don't know
help.
everything. I don't know a lot.
Thank you.
Maybe I know a little bit. That's it. But we all learn together, I guess. Then it's great when you enjoy, when you're learning. There's nothing better than that. And I can guarantee you one thing, okay? After a few weeks or months, you may feel that you forgot all these drugs, what those adverse effects were, what was important, this and that. You're like, I'm over with it. And I don't think I remember. Maybe, some of them I recall, some I don't. But I can guarantee you're never going to forget in your life. Whenever you're going to see those things, when you're working on the floor, that's when you're going to remember me. Okay, my torture, you're going to remember it. Oh, that's what he was talking about. All these drugs are going to show up on the floor. Your patients are going to take. And what I told you, that's exactly what is going to be important for you and for your patient. If you take care of that, people, the patient, their families are going to love you. They're going to respect you because you know what you're doing. We don't want to be any random nurse who's just there to make money, don't know what they're doing and putting themselves at risk. And those human beings, right? They're somebody's family. They're not just numbers, right? They're not just numbers. So be honest with yourself and do what is the right way. And in life, don't take shortcuts. They don't go long. Okay? Do the right way. They're hard,